This is Dr. Ntounis, Periodontics and Implant Specialist here at Synergy Periodontics and Implants. I would like to share with you some very important tips on how to make sure that you can maintain your prosthesis clean and successful long term. Here at Synergy, we are able and fortunate and blessed to provide many patients with their confidence back by giving them some beautiful smiles on dental implants. For us, what's important is for our patients to be successful long-term, for those restorations and for those implants to last as long as possible, hopefully even their entire lifetime, with minimum service requirements and minimum type of repair or complications. How are we going to achieve that? Well, before we get to that, it's important for me to point out that one of the main risk factors for implant failure or for potential implant complications is the previous history of gum disease that a patient may have had. And you may think, well, what does that have to do with anything since the teeth are already gone and now implants are present? In reality, gum disease is a chronic inflammatory condition. And it has been shown in study after study over the years that if a patient had gum disease and if they were suffering from complications from gum disease, they're much more prone to developing gum disease around their dental implants. It's not over, unfortunately. It's something that patients have to fight over and over with during their entire lifetime. So when we transition to an implant dentition, we need to make sure, number one, patients can clean those prosthetics very easily without having to jump through hoops. Number two, those prostheses are designed in a way that allow them to clean them very easily. For example, look at this prosthesis here on the screen. It's designed in a way that the inside of the prosthetic, the top part, the part that touches the gums and the implants, is completely smooth, doesn't allow any type of accumulation of debris or plaque, and whatever minor debris and or accumulations of plaque can easily be removed with the utilization of proxy brushes and or water pick. Let me show you what I mean. This is a video demonstration of the proper use of this proxy brush. Here, we size our patients for the appropriate size proxy brush and show them how to use it. You can see here the patient will be utilizing their own proxy brush under the prosthesis and cleaning any plaque and debris. They can do that a couple of times a day. This should not be easy. This should not be difficult. This should be something that the patient is not feeling sensitive at all when they're doing it, and utilizing a proxy brush that is not too loose or too snug is the right way to go, and we will size that together to make sure that you can utilize that home. We prefer utilizing this particular brand of proxy brushes. It's called Tepe, and they're made out of nylon. They don't bend very easily, although they do have to be replaced, but they do allow a very thorough cleaning of the underside of the prosthetic. Another important way of utilizing good cleaning methods is utilizing the water pick. The water pick, with the special tips that it has nowadays, the special implant tips, can go and thoroughly clean plaque and debris. In combination with a proxy brush, you are covered. That's all you need. Combination between water pick and proxy brush, and you'll have a perfectly clean environment under the prosthesis with no bacteria and with minimum risk or no risk at all of developing any type of gum condition, gum disease around the implants. Some of the Synergy Periodontics and Implants simple recommendations for long-term success. Come see the hygienist every 3 to 4 months. That's key. It's important. Not only are you getting a cleaner mouth, but you're also getting your oral cancer screening done. Have x-rays taken once a year. Why? It's important for us to monitor those bone levels and make sure that we're not losing any bone, especially if there are any signs of early complications starting. We want to prevent those. We want to catch those early enough and intervene immediately before they become major problems. Also, discuss with your doctor if the prosthesis needs to be removed once a year, once every 2 years, or no at all, no removal at all, especially if the prosthesis is very smooth and it can be maintained easily. You probably don't need to have the prosthesis removed. I'm looking forward to seeing you soon. Thank you so much.